Could be one, it could be 25. I've removed 66 from one uterus. So there are several types of surgeries that can be done for fibroids. I would say that the most traditional surgery out there is what's called a myomectomy. And usually a myomectomy is being done to preserve fertility. We're trying to reconstruct as best as we possibly can a more normal anatomy. Most complete, some would say, because we're actually removing the fibroid and leaving the healthy uterus, but very complex. There are stages to it. You're going in, finding the fibroids. It could be one, it could be 25. I've removed 66 from one uterus. And when you find the fibroids, you're making an incision and taking them out one by one. And then you have to suture up those areas where the fibroid has been removed and reconstructed in a way that's going to be strong enough for fertility. And when those patients recover from that procedure, it's usually a little bit of a longer recovery than some of the other alternatives because you have to take care of that uterus that has been sutured. It can be done in a what I call invasive or maximally invasive way through an incision, like a C-section incision or an up and down vertical incision, usually depending on the size of the uterus and also on the comfort level of the physician. I very rarely make vertical incisions, not because they're not ever needed, but because of my skill set and my training. And then they could also be done laparoscopically or robotically.
The route of the surgery is, again, location, location, location. So a surgical technique for myomectomy could also be the hysteroscopic approach, going through the vagina into the cervix or the opening of the uterus with a camera, and then using a device to shave down in pieces a fibroid and take it out of the body that way. Those patients leave same day. It's a very simple surgery as far as recovery.
And then hysterectomy is an option. And some people will choose that option because they're done with childbearing. They really, really, really want to eliminate the chance of recurrence. And a hysterectomy, again, can be done through an incision in the abdomen, or it can be done in a minimally invasive way, robotically or laparoscopically, where you have small incisions and a faster healing time. Usually, to be very clear, hysterectomy does not involve the ovaries. Those are two separate organs. Your ovaries are what are responsible for those hormones we've been talking about this entire time. Will help you try to prevent going into menopause post-surgically. Your uterus is where the problem is. It's what the fibroid grows from. Now we recommend that you take your tubes too, because your tubes actually, the fallopian tubes or the ends of them may have a precursor or has found to have a precursor to ovarian cancer and peritoneal cancer. So we take the tubes, and in some situations, in most situations, we recommend taking the cervix as well because we're doing this hysterectomy for pathology. Fibroids can grow on cervixes.
You know, a key thing that I always want women to be aware of is what are the risk factors. Myomectomy, when it's the most invasive version, actually can cause a lot of scar tissue, right? That scar tissue can cause an obstruction right away. It can cause an obstruction years down the road. Even with hysterectomy, we've had women who after that, they ended up dealing with mental health issues, to breast cancer.
The great thing about this type of empowering environment is that we don't want you to get to the point where your only option is surgery.
No.
However, if you're there, understand that it can be done in a safe way. No, we can't predict all outcomes, but be comfortable with your surgeon and you could have, potentially wonderful results.